We saved the best for last, the last lecture of the day from Dr. Clearfield. He's been a longtime supporter of NOMA and our mission. In October 2024, Dr. Clearfield was awarded the Best Men's Health, Best Weight Loss Clinic, a second in Best Women's Clinic. We can discuss that later. That's
well,
not
my
sexism.
mother would say, what's the matter? You only came in second.
That's right. And one of the top 3 medical practices in all of Northern Nevada. Dr. Clearfield leads integrative medicine with a distinguished career spanning nearly 50 years. Does he look that old? Okay, good positive things.
See that? I
After
graduated in 1978, believe it or not.
After earning his medical degree from the College of Osteopathic Medicine and Surgery, board-certified family practitioner, in 1982, Dr. Clearfield continued his studies with advanced training in cardiac rehab, medical acupuncture, and age management. In 1988, he spearheaded the first combined intermittent fasting and cardiac rehab in the Northeast. We're in the Northeast.
Northeast Pennsylvania.
Okay, that's the
Wilkes-Barre,
Northeast.
PA.
I got it.
Okay.
In 1991, Dr. Clearfield graduated from UCLA's Medical Acupuncture for Physicians program, going on to serve as a mentor to other students. Then as secretary of the American Academy of Medical Acupuncture, editor of the Journal of Medical Acupuncture, and chairperson of AMA's 1997 annual conference. Dr. Clearfield turned to hormone optimization as a remedy for chronic disease after meeting with several pioneers, Dr. John Lee and Dr. Neil Rozier, outside of a NOMA conference in 2003. By now, the aged Dr. Clearfield, look aged.
By the time you get done reading this, I'll be a year older.
You wrote this. Was feeling the symptoms of waiting hormones, and this newly acquired insight sent his career into overdrive. Should I continue, or are you?
I don't know. I think is that enough? That's enough, right?
He's a really smart guy. He's got some interesting stuff to talk about, especially for those of us who are old. Remember, all of us in this room are older than we've ever been, younger than we'll ever be. Dr. Clearfield.
We're older now, but then before you started reading all of that. So again, I want to thank Bruce and Dr. Jemsa for inviting me back again. As you know, I'm sort of known as the hormone guy, but we're going to switch gears a little bit today. And we're going to talk about the microbiome. You know who knows what the microbiome is? Well, if you don't know, you know, okay? If you don't know, by the time we're done, you will know. And you're going to find out that we're going to span the medical globe from Hippocrates to the GI tract to the brain to the skin and a lot of places in between. So we start with, you remember Hippocrates who declared that all of disease begins in the gut, and that was 700 million thousand years ago. And lo and behold, he was right. So there's my disclosures, which are none. And here is our objectives. We're going to talk about what is the microbiome for those of you who don't know. We're going to describe its composition, diversity, and function. We'll talk about implications of a healthy versus a dysbiotic microbiome. We're going to talk specifically about the gut-brain interaction and also skin and brain interaction. We'll talk about the diagnostic ways to look at it, and we'll talk about some therapies. Tomorrow, if you're around, I'm going to be across the way in the morning. We're going to talk about specific laboratory of functional medicine, and I'm going to go through 10 different diagnostic studies, and we're going to cover a little bit of it today. So, the microbiome is a scheme or a series of microorganisms that are living in particular body parts. And it's all over the body. It's mostly known in the GI tract, but there's a separate one in the oral cavity. There's one in the respiratory cavity, and also in the skin, and also in vaginal tissue, and they're all different. The groups are dynamic, and they change with different types of stimuli or input, including diet, exercise, medication, and other exposures. So when the microbiome became a thing with the Genome Project. That's where a lot of this revolutionary information came about, it was felt that, we had a way to go. But the problem with it is that it changes quite rapidly and dynamically. There are over 100 trillion cells in our body, 10 times the number of human cells that are living organisms that don't belong to us. And they can have up to 3.5 million genes versus 23,000 human genes. And they play roles in everything from metabolism to immunity to brain function to digestive function, and then there's some extracurricular activity also. The microbiome is composed of bacteria, viruses, fungi, and protozoa. It breaks down some of the roles of it. It breaks down complex carbohydrates. It produces short-chain fatty acids, and that's most important. It produces glutamine, arginine, which is, you should know, or if you don't know, is part of the growth hormone complex. It's a precursor. Vitamin K and folic acid. It modulates the immune system. It promotes antigens. It deconjugates bile acids and is antimicrobial. It's also anti-inflammatory. It regulates metabolisms, and as I alluded to, there's links to the skin and to the brain. So there was an inkling of it back first in 1882 and then in 1892. And this Russian biologist, his name was Elie Metchnikoff, was a resident of Hamburg, Germany. And in Hamburg, there was a cholera epidemic due to poor sanitary conditions, mostly contaminated water. And there were 8,600 deaths, which was quite a bit of the population at that time. And he had hypothesized that the bacteria in the gut could prevent cholera from taking hold. And he was mocked and made fun of. So he did and fast forward now 80 years to 1982, if you'll remember, there was an Australian gastroenterologist named Barry Marshall who proposed that H. pylori was a bacteria that caused peptic or stomach ulcers. And he was laughed, and he lost his license. And so the both of them, 1892, Metchnikoff, and 1982, Barry Marshall, drank their a concoction of what they were proposing was harmful to prove their hypotheses. And what Metchnikoff did was, after drinking the cholera, he drank pure yogurt. And the bacteria in the yogurt prevented his becoming ill from the cholera. And so that's the first sort of mention of bacteria in the gut and the GI tract, and having beneficial and or not beneficial properties in the gut. And so we're going to look at, in the gut-brain axis, we're going to look at the neural, humoral, hormonal, and immune components, and it's linked to mood, mental health issues, anxiety, depression. It influences and produces neurotransmitters, and which conflates to cognitive function, and neurodevelopment, and cognitive performance. In the skin is a community of organisms. Again, it's in the skin. There's a host immune meditation reflection in the skin, and the gut microbes impact inflammation, and it can protect against pathogens and infections. Imbalances lead to eczema, rosacea, acne, and psoriasis. It acts as a barrier, it maintains skin moisture, and it maintains skin barrier integrity. In dysbiosis, an imbalance of bacteria leads to obesity, allergies, autoimmune diseases, irritable bowel syndrome, inflammatory bowel syndromes, and even metabolic syndromes. We're going to come back to this, but our treatment protocol here is what I call the 4 R's. Sometimes there's 5 R's, sometimes there's 6 R's you can read about, but the 4 R's. Remove the harmful antigens, repair the gut lining, restore the normal microbiome, and replace the enzymes or the things that cause the chemical reactions. By the way, we're going to talk about something called postbiotics. Anybody heard of postbiotics? Not you. Right? And you've heard of postbiotics? Okay, so you're going to learn something new today, okay, if nothing else. All right, so the composition and function of the microbiome, and I'm not going to go through all this. You can find this online, and there's the reference there. But as you can see, there are many bacteria in many different cavities, and the point of it is that they're all different. And there's bacteria, there's viruses, there's fungi, and there's protozoa. And and there's specific bacteria, and they'll either aid and heal a specific entity, or in an imbalance, it will change it and become a disease-type process. So Firmicutes is a gram-positive bacteria that helps produce short-chain fatty acids. Candida produces Saccharomyces species. In the viruses, there are bacteriophages. They regulate bacterial populations. And then there's digestion and regulation of different gases, particularly hydrogen. We'll measure hydrogen and methane in the small intestine, which should not be there. And if it is there, that will give us a clue that there's bacteria in the small intestine. We call that small intestinal bacterial overgrowth. Influencing factors, and these are all things we hear about, lifestyle issues all the time. Genetics, there's not a whole lot we can do about genetics. Diet, your age, it has an influence on the microbiome. Different medications, particularly antibiotics, and lifestyle. Are they sleeping? Are you have excessive stresses? Are you exercising? These all have an effect on our, again, internal milieu, internal bacteria, and it affects our behaviors most profoundly. Diet, a high fiber, low carbohydrate diet, will help produce the short chain fatty acids. It'll shift the Firmicutes to Bacteroidetes ratio, which is where those short chain fatty acids are produced. Prebiotics are fibers, non-digestible fibers, that feed the gut bacteria, and particularly one called inulin. There's another one, arabinoactinoid. I don't know, I got that one wrong. Probiotics are the live beneficial bacteria. We all know what those are, Lactobacillus, Bifidobacterium. But postbiotics is a new concept, these are anti-inflammatory antioxidants produced by probiotics. These are the metabolites of probiotics. And the new thinking is that these postbiotics are a functional byproduct that provides probiotics their health benefits. And there are specific postbiotics that have come on the market just in the last 6 months to a year, and they are profoundly more effective than just probiotics. And if I'll give you, when we're off, I'll give you the brand names when we're not in the CME part. Again, the healthy microbiome is a rich, diverse microbial species. It can be measured, and we'll show you how to do that in a little bit. It tolerates environmental changes. It functions very versatilely, and it ensures metabolic stability and nutrient utilization. There are different phyla that are noted. Again, the Firmicutes, and I can't even pronounce that. Those are the bacteria in the Firmicutes, Bacteroides, Actinobacteria, Bifidobacterium, and then the Akkermansia are the major players here. The microbiome has a functional redundancy to it. It produces the same bacteria over and over again. It wants to be well. Short-chain fatty acid productions are made from different fibrates from multiple different species. These are microbial metabolites that are derived from the dietary fiber fermentation. There are three major types of short-chain fatty acids. Butyrate is the one that's most known, that enhances gut barrier integrity and regulates inflammation. Propionate influences lipid metabolism, and acetate influences energy production, and it's a precursor for cholesterol synthesis. And these are the key producers right here. Short-chain fatty acids, as I mentioned, is butyrate, strengthens the tight junctions in the small intestine, and it prevents the so-called leaky. You know what? You've heard the term leaky gut? Yes, no? Everybody know what that is? Anybody not know? So it strengthens the small intestinal luminal wall. Akkermansia produces mucin, and it forms a protective layer. The gut barrier is anti-inflammatory, and healthy bacteria will inhibit NF-kappa beta and reduce interleukins 1b, 6, 12, 18, and TNF alpha, and it promotes T-regulated cell production. Fiber fermentation converts polysaccharides to short-chain fatty acids, and the microbiome has a hand in synthesizing B vitamins, particularly 2, 6, 12, and vitamin K2. It has a hand in lipid and glucose metabolism. It modulates gluconeogenesis, fatty acid oxidation, insulin sensitivity, and lipid homeostasis. Okay? A healthy microbiome will reduce chronic disease load. In obesity, it will regulate our GLP-1 agonists. It decreases inflammation, supports energy. Cardiovascular system, it will support vasodilation and decrease blood pressure and reduce that TMAO metabolite. Mental health, it stimulates the vagus nerve, it improves mood and cognition, and it helps it aids in production of serotonin and several other neurotransmitters. In the GI tract, short-chain fatty acids break down fiber, regulates cholesterol and fat absorption, and converts primary to secondary bile acids. What happens when it's not healthy? A healthy microbiome is highly stable, and it is very diverse. It has many different types of bacteria. A dysbiotic microbiome reduces resiliency due to diversity loss. It is inflammatory. It produces inflammatory cytokines, lipopolysaccharides, and ammonia. And it will overgrow. There will be an overgrowth of pathogens with opportunistic microbes. It decreased microbial diversity, has a reduction in key beneficial species, and increases susceptibility to environmental stressors and pathogens. There's opportunistic pathogens like Clostridium, E. coli, and Salmonella, favors an imbalance in the pathobiomes biogenic producing toxic metabolites. A decrease in short-chain fatty acids will produce an increase in hydrogen sulfide and lipopolysaccharides. Chronic inflammation will increase gut permeability. It will result in systemic endotoxemia, lipopolysaccharide production, irritable bowel syndrome, ulcerative colitis, and even colorectal cancer if exposed enough. Dysbiosis is linked to insulin resistance, obesity, and lipid dysregulation. Reduced gut-derived GLP-1 impacts glucose metabolism. We have a loss of colonization resistance, allows pathogens to overgrow, particularly C. difficile. And neurologically, it's implicated in anxiety, depression, autism, psychiatric diseases, and neurodegenerative diseases. Cardiovascular risks from TMAO production by dysbiotic microbes will occur, and in the skin, we'll see psoriasis, acne, and skin cancer. And so what we're talking about is the root cause of disease, particularly chronic disease, as opposed to, we're going to slap a cream on your psoriasis and tell you to go home. Okay, so this is sort of, the underlayer, where it came from in the first place. Again, dysbiosis disrupts the balance between protective and harmful bacteria. Consequences are irritable bowel syndrome, Crohn's disease, colon cancer, ulcerative colitis, harmful bacteria, particularly E. coli and Clostridium, which shows up with a reduced production of short-chain fatty acids. Gut microbes influence energy harvested from food and fat storage, and dysbiotic metabolic conditions include insulin resistance, lipid imbalances, and chronic low-grade inflammation. Autoimmune diseases occur with altered gut permeability, neurological diseases, and chronic inflammation due to endotoxemia and overgrowth of bacteria. Antibiotics, as we all know, disrupts the GI tract, and what happens is, especially an extended use, we end up with the loss of microbial variety, antibiotic resistance, and the development of resistant bacterial strains. We get a weakened gut barrier, cognitive declines, and diarrhea, frequent diarrhea. Antibiotic disruptions are particularly noted in penicillins. They induce an immune deficiency. In macrolides, they alter the mucus secretion, ion transport, and create an inflammatory state. Particularly, you'll find an increase in IgA. Metronidazole will result in a decreased diversity and altered lactobacillus iners, which is a marker for gut dysbiosis. Oral contraceptives can result in inflammatory bowel disease, and you're going to find oral contraceptives will have you'll find issues with thyroid disease also. Equine estrogens alter intestinal permeability. Natural bioidentical estrogens do not. Equine estrogens alter the balance of Th1 to Th2 cytokines. Androgens can alter the gut flora also, and estrogens disruption is a two-way street. Estrogen disrupts the microbiome. The microbiome can disrupt estrogen. Vitamin K prevents gut cognitive dysfunction. It reduces neuroinflammation. Vitamin B12 deficiency will result in particularly neuropathy. It will alter homocysteine. We'll get an elevated homocysteine. And in magnesium, you'll get a malabsorption, particularly with the PPIs. Other micronutrient issues with the dysbiosis, vitamin D, which is an immune modulator, and you'll get an increase in Akkermansia and Bifidobacterium with a reduced microbial diversity and increased prevalence of gut pathogens. Vitamin D is anti-inflammatory. In zinc, we'll end up with a zinc deficiency and impaired immune reaction. Zinc maintains the gut barrier, and higher or low levels can disrupt this barrier and end up with GI-type infections. Iron deficiency will end up with an overgrowth of E. coli and a suppression of lactobacillus. A lot of times, as you know, when we supplement with iron, we end up with GI issues, and there's this sort of push-pull between the good bacteria and the bad, and that's part of the picture. Vitamin A maintains gut epithelial lining. It's crucial for skin development and growth, and it disrupts a disruption of diversity with low levels of vitamin A. Copper is an enzymatic process, and a low copper disruption will result in and from a reduced diversity. So, key mechanisms, leaky gut syndrome, you'll get that increase in the tight junctions with an allowance of food particles and bacteria to enter the bloodstream. We'll get a reduced short-chain fatty acids, and health outcomes is an increase in fragility, frailty, cognitive decline, cardiovascular disease, and diabetes mellitus type 2. Dysbiosis increases pro-inflammatory bacteria, and it fuels low-grade inflammation. It's that we've all said it before, you have a gut feeling. So the bacteria will influence the brain, and the brain can influence the gut. It's bidirectional. Functions that are affected include hunger and satiety, food preferences and cravings, food sensitivities and intolerances, gut motility, digestion, and metabolism. The enteric nervous system is controlled by the vagus nerve, with sensory info going from the gut to the brain and motor signals going from the brain to the gut. And the gut microbiome can generate neurotransmitters, including dopamine, norepinephrine, serotonin, and GABA. It can affect your mood, your behavior, stress levels, pain, and cognitive function, and also immunity. The metabolites of the gut microbiome will affect the enteric nervous system, including the brain, the immune system, and the endocrine system. Again, that gut feeling, butterflies in the stomach, gutting it out, gut wrenching, all these terms that we use, there's actually a physiologic reason for them. Hormones that are affected are including cortisol, and too much cortisol, excess cortisol, usually from stress, will affect Bifidobacterium and Lactobacillus, leading to dysbiosis and low-grade inflammation. Glucose metabolism, glucagon will inhibit food intake and stimulate brown fat thermogenesis. Ghrelin and orexin reestablish appetite during fasting. CCK and gastrin and pancreatic polypeptides will affect satiety and gastric emptying. And the ghrelin pathway is one of the two ways that the brain and the hypothalamus and pituitary generate growth hormone. These are the key neurotransmitters that are generated in the gut, and I mentioned them briefly. So dopamine, norepinephrine, serotonin, and GABA. And the gut microbes produce these neurotransmitter metabolites, and the metabolites are transported through the bloodstream to the organs of origin and also back to the brain. And it, again, can affect mood, cognition, stress, and responses. Mood regulation, cognitive function are affected by the microbiome, and anxiety, depression. So the tryptophan metabolism, serotonin synthesis, and mood modulation. At present, I'm taking the sort of online intake course on ketamine, and ketamine IV and orally and intranasally for chronic refractory depression and pain. And there's no mention so far, I'm about halfway through, of the microbiome, and there was one mention of somebody in a case history of saying maybe we should take a look at testosterone. And as you know, we found that these have been most helpful. So the hormones, again, estrogen, beta-glucuronidase will increase circulating estrogen, and estrogen extinguishes fear. And when the microbiome is disrupted, you will get actually an excess of estrogen. And when there's increased circulating estrogen, we like to use calcium deglucurate. Testosterone dysbiosis will degrade or lower testosterone, which can lead to depression. The testosterone levels are at 295 for men total, and at 20 for females. They are at risk for depression. When the testosterone levels at about 150 for men and less than 10 for females, there is a frank depression component to their hormone disruption. Progesterone dysbiosis disrupts the metabolism and breakdown of progesterone, leading to lower progesterone, and it elevated levels in pregnancy results in a listeria type milieu that can develop. This can lead to stillbirth, premature labor, and again, an inhibition of Th1 responses and pro-inflammatory interferon gamma. It also promotes Th2 responses with the synthesis of anti-inflammatory cytokines when it has been resolved. The thyroid, the autoimmune response triggers will disrupt the absorption of iodine and interferes with T4 to T3 conversion. The leaky gut comes from, as many of us have found out, celiac sensitivity or gliadin allergy, and also non-celiac wheat sensitivities. We'll see an increase in the firmicutes to bacteroides ratio with a reduced bacterial diversity, decreased short-chain fatty acids, lipopolysaccharide activation, and a decrease in the minerals that we talked about before. Cortisol, increased stress, the circadian rhythm is disrupted. We end up with a negative feedback, an increase in stress-related symptoms, and an increase in gut permeability. Remedies here would be an increase in fiber, which will decrease cortisol. Prebiotics will decrease cortisol also, and you should see an improvement in cognition and mood. Growth hormone. Growth hormone is generated in the anterior pituitary gland by the growth hormone generating hormone and the growth hormone releasing peptide. The growth hormone releasing peptide is produced in the ghrelin pathway in the stomach. When there is a disruption in the microbiome, we'll have a disruption in this ghrelin pathway. We'll get an increase in interleukin-6 that creates a relative IGF-1 deficiency. This can result in impairment in growth and development, especially in children. And what we see is a deficit in executive function. And so, like I said, we see a lot of, we go a long way from just the GI tract here in the microbiome. And I'm going to take a short segue into autism. Here. So autism is characterized by hypersensitivity, language delay, repetitive behaviors, and social isolation. It can result from what's known as in the literature as maternal activation. And usually these are infections or disruptions or injuries to the placenta in utero. We see a microglial activation, an inflammation, and then a cytokine storm. And what we see is an increase in growth hormone, but a decrease in IGF-1, which is the usable portion of growth hormone. And it comes about because there's an elevated production of interleukin-6, which disrupts the growth hormone to IGF-1 pathway. It results in a big empty-headed kid, and usually that's, looking back on it, because the parents usually, don't notice it right away. But these children's heads are usually, by the time they're 5 years old, they're the full-grown adult size of head circumference. They end up with cerebellar dysfunction, low GABA, or the calming neurotransmitter, and they have these repetitive, restless type behaviors. These are the symptoms of low growth hormone deficiency, which are memory, concentration, mental clarity, obsessive compulsive tendencies, paranoias, and these are the main symptoms of autism or autistic spectrum on the right. Particularly the inability to switch tasks. As you can see, the symptoms pretty much match up. This is the mental and psychological pathways in the liver of conjugating cholesterol to the end organ systems. And what happens is on the left-hand side, we get a generation of cholesterol to pregnenolone, to progesterone, with a conversion of progesterone to 5-alpha dihydroprogesterone to allopregnenolone. Allopregnenolone is stimulates the generation of the neurotransmitter GABA, which is our calming neurotransmitter. It is generated by the conversion of 5-alpha dihydroprogesterone by 3-alpha hydroxysteroid dehydrogenase. When the microbiome is disrupted in utero And in these children, when they're young, we get a disruption of this enzyme here, and this is where a lot of the behavioral issues will come, and that's what this sort of depicts here. Okay, so maternal immune activation, usually from infections or injury. We get microglial cell activation, cytokine storms, and elevation in interleukin-6. Hypothalamus and cerebrum will enlarge. The cerebellum shrinks. We get an increase in serum growth hormone, but a lowering of, or not enough, IGF-1, which is the usable portion of growth hormone. So we get growth we get external growth with no internal growth. The cerebellum shrinks in response. Growth hormone damages the Purkinje fibers. We get a decrease in GABA, or the calming neurotransmitter, which results in the repetitive behavior, language, social withdrawal, and hypersensitivity. So let's connect that back to what we're talking about is the microbiome now. Okay, and what happens is with this inflammation, we get a decrease in the short-chain fatty acids, increased lipopolysaccharides. We'll end up with insulin resistance, and so we end up with metabolic issues, we end up with skin issues, and we end up with cerebral issues also. So, in the skin, imbalances in the immune system, nervous system, and hormonal signaling end up with GI and skin issues together. And you know, I'm nervous and it comes out in my skin. I'm eating bad, and that also comes out in our skin. There's specific bacteria can lead to specific skin maladies, so ruminococcus can lead to gut barrier dysfunction, irritable bowel syndrome, coronary artery disease, eczema, and spondyloarthritis. A decrease in akkermansia can affect psoriasis progression, and inversely related to different types of cardiovascular diseases, diabetes, obesity, and autoimmune type issues. Stress, as you know, I'm stressed out. It shows up in the skin as psoriasis or eczema, increase in cortisol, the disruption in the balance of hormones. It impacts the integrity of the gut lining and the skin barrier, and it modulates neurotransmitters, particularly dopamine, norepinephrine, and serotonin. Estrogen will strengthen the skin barrier. Progesterone balances skin production and growth. An imbalance will result in inflammatory activity, excessive oil production. It clogs the pores, and you end up with acne-like lesions. And so if you're not familiar with excess progesterone, that's what will happen. You'll get acne-like lesions. Everybody thinks it's just testosterone, but it's not. Testosterone weakens the skin's ability to retain moisture, and it increases the skin's permeability with a compromised barrier. Diet can directly influence the microbiome, and so fruits, vegetables, all the good stuff that we tell everybody to eat will promote beneficial bacteria and gut diversity. Fermented foods will help with diversity also. High fiber diet increases anti-inflammatory short-chain fatty acids. Processed foods and added sugars and saturated fats, as you know, is not very good. Probiotics will benefit the skin, improve acne, eczema, psoriasis, and topical probiotics improve the skin microbiome and skin barrier. Prebiotics, again, are the fibers that feed the gut bacteria. Probiotics are the beneficial gut bacteria. And these postbiotics are the inactive microbial cells that are produced by the probiotics. And it's thought now that these are the substances that create the health benefits from the probiotics. And this is just kind of a depiction of that. Nutritional remedies for the skin include vitamin D, and we titrate the patient's vitamin D levels to 50 to 80 nanograms per milliliter. For every 1,000 units of a good quality vitamin D, and we use D3 because it's the best absorbed, you will increase your 25-hydroxy vitamin D level by about 8 points. So 5,000 units, 5 times 8, will increase the 25-hydroxy vitamin D level by by about 40 points, and it takes about 4 to 6 weeks to do that. Curcumin is an antioxidant, anti-inflammatory. We use this, it's beneficial for psoriasis. Some of the measures that we do, here particularly we measure C-reactive protein. We want the C-reactive protein, normal is about 0 to 3, and the units escape me at the moment. We want this to be less than 1.0. Curcumin is particularly good for joint pain and aches and pains, muscle pain. Omega-3 fatty acids are also anti-inflammatory. We also will want the C-reactive protein to be less than 1.0. If it's greater than that, we will recommend some omega-3 fatty acids. And we usually end up, we start usually with 2.6 grams of EPA and DHEA. That will improve the psoriasis, and we'll go up to about 4 grams if necessary. Vitamin A regulates keratinization and sebum production. It prevents the clogging of pores, it reduces acne lesions, and we've used Retin A and isoretinoin for a long time. Doses 800 to 10,000 micrograms depending on the form, and the topical retinols are quite good. Vitamin C is good for collagen synthesis, wound healing. It modulates cytokines. It regulates dopamine, and the cytokines levels are increased by 60% in autistic patients. And the doses usually we range, if we want a good response from vitamin C for these issues, 1 to 5,000 milligrams per day. Vitamin E is an anti-aging agent. Use the mixed tocopherols. You don't want to use just plain vitamin E, 400 units per day. Zinc is immune function and skin healing, and there's different doses of zinc for different types of issues. For the skin here, all you need is about 8 milligrams for females and 11 milligrams for males. We usually use zinc picolinate as our substrate. Fiber produces beneficial gut bacteria and improves the skin integrity. Herbal remedies that we like, neem is a Ayurvedic, comes from India. It's a leaf, it's antimicrobial and anti-inflammatory, and it's useful for acne, eczema, and psoriasis. You can get it, it comes topically or orally, 300 milligram capsule or twice a day is usually enough of that. Boswellia can come as a homeopathic remedy. It can come as an oil. It's also known as frankincense, and it's an anti-inflammatory, and again, beneficial for eczema and psoriasis. 300 milligrams in a standardized extract 1 to 3 times a day for 12 weeks, or as a topical, and you use that for about 30 days for psoriasis and eczema. You also need to change the diet, of course. Evening primrose oil for atopic dermatitis, 500 milligrams a day for 6 months. Collagen supplementation provides the skin with an increased strength. Oral supplementation with fish collagen peptide improves skin aging. Increases in skin moisture and collagen density in the dermis, and 10 grams of fish collagen peptides is what's recommended. NMN is an NAD precursor. It supports mitochondrial function and muscle remodeling, 250 to 600 milligrams per day. Indications for diagnostic microbiome testing are all of these things. Anybody seeking optimal health, anybody with chronic digestive dysfunctions, known GI disorders, neurological and cognitive disorders, skin disorders, metabolic and weight issues, and what I call meshuganosis. We all know those. They come in and every system is off. You ask them every question is the answer is yes. So if you don't know where to go, start here. There are lots of different tests that you can do. This is the one that I like, and when the CME credits are off, I'll tell you what the formal name of it is. This is a comprehensive stool test. It's a quantitative polymerase chain reaction. It measures the DNA of 40 different types of microbes. It provides colony-forming units per gram, and it gives us markers for absorption, digestion, inflammation, the immune function. Commensal bacteria, low levels indicate dietary issues. Different types of phyla which an increase in ratio of Bacteroides to Firmicutes will be seen in weight gain and obesity, decreased insulin sensitivity, and increased inflammation. Different types of bacteria that are tested: H. pylori, Clostridium difficile. It'll measure opportunistic bacteria, and those are not anything that we really need to do anything about, except that you know that the microbiome is disrupted if they're too high or too low. There's autoimmune inducing bacteria, including Citrobacter and Klebsiella. There are viral antigens, yeast that can be present, and also parasites and worms. So we measure all of these. I didn't get a good picture. I know that you can't probably read this. So this is just a sample. These are, so the DL is basically normal. This is Clostridium difficile, toxins A and B, and this is Yersinia. Yersinia usually shows up with our common variety food poisoning. There are parasitic pathogens here. There are viral pathogens here. And this is H. pylori, and it will get different subsets of H. pylori, and you'll see at the end of this that we're gonna be able to get genetic markers for them also, and it'll tell us how to take care of it. Over here, you have dysbiotic and overgrown bacteria, so these are pathogens here. You'll get commensal overgrowth here. These are the ones that are really not a problem, except if they're disrupted, you know that the microbiome is off balance. These are inflammatory bacteria here, and these are commensal inflammatory bacteria here. Here are fungi or yeast, and down here are different types of viruses, so cytomegalovirus and Epstein-Barr. Different parasites are up here, and then there's some intestinal markers also, and then I have them listed here. So steatocrit, this one here, and this is showing normal. That's how patients' fecal fat, are they absorbing fat, are they processing fat properly? Elastase is pancreatic enzymes. They're showing you these two are good here. I mentioned beta-glucuronidase before. This is estrogen-induced diseases that you're going to see that this is going to be elevated in, and dysbiosis, and they're showing you here that the patient is high in beta-glucuronidase. Occult blood, is normal. Secretory IgA, this is your primary immune globulin in the GI tract. High secretory IgA levels indicate infection and dysbiosis and food sensitivity, and low, there's dysbiosis, stress, and immune compromise. Anti-gliadin IgA is immune response to gluten, but don't be fooled by that. If it's negative, it doesn't mean that the patients aren't gluten sensitive. Eosinophils reflect infections and different types of allergies. Calprotectin is a marker for Crohn's disease, ulcerative colitis, also irritable bowel syndrome. This is our gold standard as an inflammatory marker, and zonulin measures intestinal permeability. This is a look at antibiotic-resistant genes for H. pylori. So this will tell us which antibiotics will be effective and which ones won't. But don't be fooled by what you're looking at. What you're looking at is when it says it's positive for resistant genes. That means that amoxicillin here and clarithromycin here will not work for this patient's H. pylori. You need to go to the fluoroquinolones and tetracyclines here. Okay, so positive doesn't always mean what we think it means in positive. This is antibiotic-resistant genes. When they're positive, that means that these antibiotics will be resistant to the H. pylori. Then there's also the mucosal barrier assessment. And tomorrow morning, across the way, I'm going to be doing a whole, I think it'll take almost 2 hours, on just functional medicine laboratory studies. So if you're interested in that, we'll go into a lot more detail on all of these. So zonulin, again, regulates intestinal permeability. Diamine oxidase enzyme degrades histamine, and it's affected by B6, vitamin C, and copper can affect it also. Histamine, as you know, is involved in immune responses. High levels can cause headaches, diarrhea, allergy-type symptoms, rhinitis, the dark circles under the eyes, and lipopolysaccharides are endotoxins that are produced by gram-negative bacteria. When they're high, it's an indication of neuroinflammation. When they're low, it's an indication of an immune deficiency. Zonulin, these are just the lab levels. Low zonulin levels doesn't really mean anything. Low diamine oxidase levels reflect atrophied microvilli and permeability and ongoing damage and cell dysfunction. And low histamine, the patients can have some depression and fatigue. High levels, on the other hand, is where the action's at. And so high levels of zonulin indicate bacterial, yeast, and gluten infections. This is your so-called leaky gut. High diamine oxidase levels is usually compensatory due to high histamine levels. And when we lower histamine levels, we'll lower the DAO levels. High histamine levels can trigger antigens and the mast cell degranulation. Lipopolysaccharides, again, when low lipopolysaccharides are indicative of a worn down immune system. High lipopolysaccharides show active immune response against bacterial overload. This is what the test looks like. So this is the report that you'll get back, and here's the zonulin, diamine oxidase, histamine. There's a ratio between them. And then here's the lipopolysaccharides, and you'll get IgA, IgG, and IgM. Here's the indications for them, and again, pretty much the same as the microbiome. Again, autoimmunity, food sensitivities, digestive symptoms, headaches, arrhythmias, cardiovascular disease, and any condition that can lead to a leaky gut. And again, if you're stuck, okay, this is not a bad place to go. So the GI stool test, the mucosal barrier, and then we're gonna look at metabolic wellness. We're gonna look at 3 parameters there. So again, what to do about it? Diet can remove the triggering or inflammatory foods, particularly gluten. Supplementation, diamine oxidase, you can get that as a supplement. Vitamin C, vitamin E, vitamin B, omega-3 fatty acids, and quercetin, which is another anti-inflammatory. Antimicrobial supplements or herbal remedies include garlic, oregano, and berberine to treat dysbiosis. I wouldn't use antibiotics unless I had positive, markers for them in either the stool or in the blood. And immunoglobulins can be supported with colostrum or collagen. Metabolic wellness is another panel that you can look at, and this is sort of an easy way to get a better look, especially since this is a lot less expensive and a lot easier to get. And any of your major labs will run these, and so we will look at urinary indican, which will reflect digestion. Urinary bile acids reflects detoxification, and oxidative stress or aging of cells is our 8-hydroxydeoxyguanosine. So these are the 3 levels. These are the 3 other tests, and this is a report that you'll get here. With these 3, indican is a dysbiosis indicator for small intestinal bacterial overgrowth, malabsorption, poor protein digestion. It's a screening tool for dysbiosis and for protein regulation and digestion. Symptoms are all of these things here, and again, low protein basically, and the poor glycemic control, poor protein, either intake, malabsorption, hormones and fluid imbalances, infections like candida and liver type issues. Very high levels show HCl insufficiency, hypochlorhydria, and protease enzyme deficiencies. This is the test that This is the test here. It's a urine test, and you just match the colors. Okay, and you can get this, your local labs or your hospital lab. You can get it from your supply. You can do it in your office yourself. It's not that expensive. Lower high levels will be inadequate protein, either digestion or absorption, intestinal toxemia, undigested foods, and various stomach disorders, HCl deficiency, and pancreatic insufficiency. And your patients that have been on PPIs for 30 and 40 years, look at them, because this is where we'll see the symptoms of low and high stomach acid are pretty much match each other, and a lot of times these patients have low stomach acid, not high stomach acid.
So omeprazole is not something good.
What?
Omeprazole?
Yeah, PPIs. Okay. Total bile acids. Bile acids were not removed from the liver. It's a screen for liver dysfunction, viral disease, cirrhosis, drug-induced liver injury, and cholecystitis. Cholesterol elimination, fat absorption. It regulates energy expenditures, glucose, and lipid metabolism is the role of bile acids. Low bile acids are seen in inflammatory bowel diseases, chronic malabsorption, persistent diarrhea, and starvation. 8-hydroxydeoxyguanosine is a biomarker for reactive oxidative stress. Sources of high 8-hydroxydeoxyguanosine include increased cellular metabolism, chemical exposure, and exposure to exogenous physical damage. And low levels are seen in DNA breaks, aging, and cancers. So this is oxidative stress. This is a marker for aging, is basically what it is. Okay, we see it in cancer, see it in degenerative diseases, metabolic disorders, respiratory disorders, neurologic disorders, and inflammatory issues. And in not enough exercise or over-exercise. So basically, and so this is, here are your basics again. I mentioned them briefly. Dietary interventions, prebiotics, probiotics, and postbiotics. Remember, guys, back there, we were checking for the numbers here. Remember, they were all okay? And this is what happens. So it should be 1, 2, 3, and 4. It's not your doing. It's what happens when we transfer it. Prebiotics, probiotics, postbiotics, medication, supplementation, and another new kid on the block is the fecal microbiome biota transplant. Dietary interventions, fiber-rich foods, organically grown whole foods. They provide essential nutrients for the gut microbiomes to flourish, and fermented foods, incorporating yogurts, kefir, kimchi, and sour cream. Sauerkraut, sorry, not sour cream. Regular exercise, good quality sleep, stress management, limit alcohol intake, mindful use of antibiotics only when necessary. Do your best to avoid toxins, chemicals, pesticides, heavy metals, and to minimize inflammatory foods. White flour, white sugar, dairy, gluten, and corn. Those are the bad guys. Gluten effects. Gluten shifts the GI microflora to a pro-inflammatory state. It leads to that leaky gut, which renders the patient vulnerable to gliadin and gluten protein inflammation. Digestive enzymes metabolize gliadin into an opioid-like substance called gliadinomorphin 7, and casein from dairy breaks down into casomorphin. So these are sort of mini opioids. Peptides that are small enough to pass through the gut barrier into the bloodstream and into the blood-brain barrier into the brain. The peptides compete for opioid receptors with normal neurotransmitters, and they usually win. Here are some behaviors associated with gluten sensitivity: social withdrawal, slurred speech, decreased coordination, loss of interest in activities, stealing, lack of motivation, depressed mood, weight gain or lack of weight gain, cramping, diarrhea, hives, itchy skin, joint pain, nausea, vomiting, headaches, loss of concentration, apathy, confusion, or disorientation. And the remedy is, again, the 4 R's. We're going to remove The inflammatory foods, we're going to remove gastric irritants, including alcohol, coffee, or rather caffeine, and harmful microorganisms. You're going to replace the disrupted digestive enzymes. You're going to replace hydrochloric acid if necessary, and you're going to replace the bile salts, and we've already measured those. An easy way to tell if your patient has low or high hydrochloric acid, well, you can do those little strips, but what you can do is have the patient use a TMG or HCl capsules. You can get them, and on the day you're going to start your testing for this, at their first meal, they'll take 1. The second meal, lunch, they'll take 2 of them. The third meal, dinner, they'll take 3. If they have no reaction, you go to day 2, and then you'll take 4. With the 5th meal at lunch, you'll take 5, until they start getting abdominal pain, heartburn, and feelings of increased stomach acid. If it takes 1 to 3 pills to get the stomach, to get that feeling, they have high stomach acid. If it takes 9, 10, 11 pills to get there, then they have low stomach acid. So this is, what's that? HCl, betaine, right? Betaine. Probiotics, again, reestablish the gut flora. Prebiotics are the non-digestible fiber. We talked about a number of times the postbiotics, and then fermented foods. That's our restore. And then repair here, L-glutamine supports intestinal lining, zinc repairs tissues, omega-3 fatty acids reduces inflammation, slippery elm will soothe a GI lining inflammation, vitamins A, C, and E are anti-inflammatory, and aloe vera is also will help the GI lining. This is just a schematic of what I just told you. Remedies, I got 15 minutes left. Anybody have any questions so far? No? Keep going? Okay. Again, remedies, again, probiotics, prebiotics. We like spore-based probiotics to modulate this gut-skin barrier. It reduces facial sebum production and produces short-chain fatty acids. And again, our postbiotics. Specific probiotics for specific entities. Sometimes the strains are critical. Sometimes the timing is critical. You want to take the probiotics at least 2 hours after, if you're treating somebody with H. pylori, antibiotics. Typically, you need to use the probiotics for a long enough period of time. It could be anywhere from 4 to 8 weeks up to 6 months. Again, dietary support. We combine it with specific diets. There's the FODMAP diet, low FODMAP diet, specific carbohydrate diet for SIBO, and an anti-inflammatory diet for H. pylori. Different combinations work better. If you're not sure how to do this, or you're new at this, start low, go slow. And again, it usually takes 4 to 8 weeks before you're going to get any type of effect. You have to tell the patients, don't call me in 2 weeks and tell me that you're not any better. You're not going to be better. Different types of probiotics specifically for SIBO. Saccharomyces boulardii is a yeast-derived probiotic. It does not produce any types of gas. It modulates gut inflammation and supports the immune function. Spore-based probiotics will improve stomach acid, regulates gut flora, and does not exacerbate SIBO. And in common strains are Bacillus coagulans and Bacillus subtilis. Low fermentability probiotics are anti-inflammatory, and non-bacteria are betaine or hydrochloric acid and bile acids. For H. pylori, Lactobacillus reuteri, Lactobacillus rhamnosus, and Bifidobacterium lactis, and Saccharomyces boulardii. These are the probiotics that you want to use for H. pylori. Inflammatory bowel disease, you can use a multi-strain probiotic and Saccharomyces boulardii. irritable bowel syndrome, Bifidobacterium infantis, Saccharomyces boulardii, Lactobacillus plantarum, and a multi-strain combination of Lactobacillus and Bifidobacterium. C. difficile, again, Saccharomyces boulardii, Lactobacillus rhamnosus, and a multi-strain. Diverticular disease, Lactobacillus casei, and so you need to look these up. You need to find which of your probiotics have specific bacteria in them. And Lactobacillus plantarum, microscopic colitis, Saccharomyces boulardii, and it's effective in antibiotic-associated diarrhea. Upper GI pathogens, so upper GI would be the stomach and also probably the small intestine. GI barrier effects for berberine. Berberine is good for blood sugars. It's antimicrobial. It blocks bacterial adhesion to epithelial cells. It's anti-inflammatory and has some anti-neoplastic effects. And it is effective against NF-kappa beta, TNF-alpha, interleukin-6, and COX-2. Vitamin A is anti-inflammatory and helps and maintains vision and promotes growth and development, and is antimicrobial. Zinc strengthens the tight junctions. Grapefruit seed extract improves GI symptoms, improves total cholesterol and LDL cholesterol, improves C-reactive protein and fasting blood sugars, but has no effect on hemoglobin A1C or HDL. It is antibacterial, antiviral, antifungal. It will inhibit Candida and Staph aureus and E. coli. Doses are there. Usually we use the pill form 250 to 750 twice a day. This is an herbal remedy. I found this herbal remedy. It's a combination of oils and lemon balm. Be careful with lemon balm in patients that are hyperthyroid, or rather hypothyroid. Lemon balm will lower your thyroid function. Herbal remedies are as effective as triple antibiotic therapies, at least in this study here, number 100, for SIBO. And it's a rescue therapy for rifaximin non-responders. Simple carbohydrate diet reduces overall bacterial overgrowth, supports bowel function, and it reduces bacterial load. Candida overgrowth, Saccharomyces boulardii, silymarin, which is milk thistle, garlic, and caprylic acid. Heliobacter, H. pylori, again, we're all kind of familiar with this, thrives in an acidic environment. It produces urase. It neutralizes stomach acid. It allows colonization of the gastric mucosa. It damages the stomach lining via inflammation, toxin production, and it disrupts gastric homeostasis. We will frequently see H. pylori as a trigger for autoimmune diseases, particularly thyroid autoimmune disease, Hashimoto's thyroiditis. Extragastric effects beyond the stomach, we have rashes, joint pain, and I just mentioned autoimmune thyroiditis, also thrombocytopenia. We get immune dysregulation and chronic inflammation. In the skin, we can get atopic dermatitis, and H. pylori antibodies are found in 70% of patients with atopic dermatitis. Etiologies are crowded living, poor sanitation, poor hygiene, and poor dietary intake. Non-invasive tests you can use are urea breath test, stool antigens, and serology. They seem to be less effective than at least the stool antigen test, and of course endoscopy with biopsy. Functional medicine approaches, comprehensive stool testing, gastric pH testing, and food sensitivity testing. Conventional treatment for H. pylori, triple antibiotic therapy, sometimes quadruple antibiotic therapy, so 2 antibiotics with a PPI and bismuth. You can do it sequentially or concomitantly. Acid suppression, H2 blockers are sometimes useful, and monitor for if it's been an effective treatment, because these are very resistant and will recur. In the over-the-counter world, botanic antimicrobials include mastic gum, berberine, oregano, manuka honey, and grapefruit seed extract. You want to restore the GI function with betaine, which is your hydrochloric acid, zinc carnosine, which is anti-inflammatory. Zinc carnosine is very effective, as PPIs, at least in our practice, and we don't use PPIs at all. Deglycerinated licorice is another entity effective for GERD and hiatal hernia pain. Vitamin A, 25,000 units a day, and vitamin D, again, we titrate it to 50 to 80 nanograms per deciliter. Probiotics and gut microbiome balance, so lactobacillus, Saccharomyces, and again, the postbiotics. Anti-inflammatory diet, stress reduction, improved sleep. This goes for everything. This is a study done. 74% of patients in this study, 39 patients, used a combination that we used here in the herbal remedies, had a complete eradication of the H. pylori, and the three components were mastic gum, oil of oregano, and Pepto-Bismol. Prevention of H. pylori, good hygiene, good dietary choices, gut health, neuroinflammatory remedies. Sulforaphane is found in cruciferous vegetables. It increases cytoprotective genes in brain tissue and preserves blood-brain barrier. It reduces interleukins 2, 4, 6, interferon gamma, dose of 400 micrograms per day. Curcumin, green tea extract, and lithium orotate. I did give a little bit on sulforaphane here. So again, this is in broccoli extract. It converts the 5-dihydroprogesterone into allopregnenolone. I alluded to this before. The dose is 0.1 to 0.5 milligrams per kilogram. It increases cognition, reduces neuroinflammation, and it can also be useful for hair growth. Again, gut-brain axis support, high fiber diet, psychobiotics, anti-inflammatory diet, and autonomic nervous system rebalancing, tyrosine, GABA, glutamine, and vitamin C. Intestinal permeability remedies, L-glutamine, vitamin D, Lactobacillus plantarum, and fiber. Gut axis support, probiotics, vitamin C and E, and zinc. Natural remedies, again, so boswellia, neem, omega-3 fatty acids, and collagen. Fecal microbiota transplant. This is it's sort of a whole new cottage industry. The FDA has approved this only for C. difficile, and it's been sort of tightly controlled. It restores healthy microbiome ecosystem. Stools transferred from healthy donors into the gut of a recipient, and it resets the microbiome and restores gut barrier health. It's useful for all of these entities here, including things like autism, anxiety, depression. Obviously, you would only do this if it was severely refractory. It restores microbial diversity, strengthens the gut barrier, modulates the immune system. It healing the gut-brain barrier. It increases production of serotonin, dopamine, and GABA, has a positive influence on mental health. It improves immune and cytokine modulation. It reduces these pro-inflammatory cytokines that are here, interleukins 1B, 1RA, 6. It will reduce C-reactive protein, interferon, and interferon gamma, and it will result in improved behavioral and cognitive issues. Skin inflammation, hormonal control, skin barrier support, the fecal microbiome transfer will improve. The biggest challenge now is learning how to do it. There's all sorts of FDA interference at the moment. There's strict donor screening for this, and there's a lack of standardization. So there are some capsules that have been developed. So these are sort of in their infant stage, and there's begun some personal microbiome banking. So this is a groundbreaking treatment for restoring gut health. It addresses systemic conditions related to the gut-brain axis. It reduces or eliminates dysbiosis, inflammation, and enhances the gut barrier, and useful in leaky gut, mental health disorders, and skin disorders. This is a table of the intestinal biomarker that I talked about, and this is an explanation of what it is, what you see with elevated levels, low levels, and remedies. Anybody who wants this, let me know. We'll get that to you. This is just a summary. Influencing factors, I mentioned this, I've repeated myself a couple of times here. Healing the gut, this is just a summary of that. So remove the bad guys, put in the good guys, high fiber foods, omega-3 fatty acids, anti-inflammatory foods, herbs, spices, re-inoculate the GI tract with probiotics, prebiotics, and postbiotics, fermented foods, and then repair with these remedies here. And that's it. Thank you. I had 15 seconds left.
We have a question online for you, Dr. Clearfield. Victor Klausner writes in that this was a fantastic lecture, and his question addresses the vitamins, herbal supplements, and probiotic supplements. You earlier had suggested that your patients use an array of 10 to 15 kind of different types of supplements. How do they take so many different products? It seems like some of them are hard to find. Where are your patients accessing the supplements that you're recommending?
Well, they can get them online. They can go to Walmart. We don't recommend that. There are those that are knowledgeable in herbal remedies, over-the-counter remedies. There are pharmaceutical grade companies that make pharmaceutical grade supplements. And again, I can't mention in the CME track, I can't mention brand names, but I can give them to you afterwards. And it takes a little bit of practice to learn where these are. But if you seek out those of your colleagues that do know, and expand, you want to expand your horizon.
Got it. And then we have one question over here, if you want to hit that, and then we have one more online. He denies. He denies me 3 times. So there's also a mention of that we're very appreciative of the lecture and your mission to cure Mashuganosis syndrome.
You like that one?
As well. And then Dr. Zinni wrote in a great comprehensive overview. And about mangosteen itself, he says, is it a postbiotic? Because its consumption can indirectly support the production of postbiotics by enhancing the gut microbiota and promoting a healthy gut environment. Do you have any thoughts or opinions on that?
I didn't hear what he said. What was the postbiotic?
He was saying, mangosteen is he said the fruit called mangosteen. Do you have any thoughts on that?
No, I don't think that's a post. No, I'm not sure. Dr. Halassa, do you know what that was? I'm going to pass on mangosteen.
Skin of the mango, there's some proteins on it.
Yeah, I've seen it used for weight loss. I'm really familiar with it, to tell you the truth. That's not something I've sort of come across. So
okay.
I'm going to just have to pass on that one.
Okay, we'll pass.
Question? Sir?
Yes.
Go.
Let me just spice the whole lecture with something that I experienced. Yeah. My experience with the patient was resistance to all this triple therapy for the antibiotics and that's been used to manage Helicobacter pylori. And the only solution that we are able to fix that problem is giving them Metlam blue and shine a red light inside the stomach through a fiber optic laser.
Right.
And since then, that's done.
Yes, okay.
So it's just I'm trying to spice up the
I mean, there are many other remedies. These are the basics, okay? We'll do the more exotic ones in our next talk. Okay, what I gave you here today. These were the basics.
No, just spicing the lecture to somebody has a problem with. You're eradicating Helicobacter pylori. There's another solution.
Yeah. Okay. So,
Dr. Clearfield, you mentioned different laboratory profiles that you can get. Mm-hmm. Are we talking about local labs, Quest, LabPort?
You can get them from there. All the ones that I mentioned, that you can get them from there. There are some specialty ones we use, but I can't mention them until they turn the tape off. So when they do turn the tape off, I'll give you the names of them.
Okay, sounds good. Yeah.
Wait.
Execute. No, keep going. Ball it out.
A question about digestive enzymes. Do you use prescription enzymes like Creon or something over the counter?
I use over-the-counter ones. Again, we use pharmaceutical grade enzymes, and I find that they work quite well. You can use the prescription ones, obviously, but again, if you know, there are a number of companies that make pharmaceutical grade supplements that are quite extensively studied, and they are quite effective.
And on the length of use, do you feel there's a chance of negative biofeedback on the patient that has pancreatic insufficiency?
I didn't hear the question.
So on the length of use of the enzyme, do you feel there is a chance of negative biofeedback when the patient has a pancreatic insufficiency?
I'm not sure I understand the question.
So just to break it down really simple, someone who has enzyme insufficiency
Right.
because of pancreatic problems, you supplement because you just know clinically there is a problem?
Well, no, I gave you what to look for, right?
I'm sorry?
We gave you what to look for. We gave you
Right.
a number of tests. You can do them, and again, you can get them at any lab.
Okay.
Okay? Yeah.
Yep. Thank you.
Okay.
Can I have the last question, something that, again, spicing the whole
Yeah, you forgot amloxanol.
One other thing that there's a doctor that is my friend of mine, and he's a neurologist, and he asks a lot of questions about the stool. If it's floating, color, smell, and all that, will give you some indication that the patient may have dysbiosis. So those things may help to start before you go to the expensive lab. And the other thing is that irritable bowel syndrome, it's being managed by the mainstream medicine with all those neuroleptic drugs and anti-diarrhea, and some of them is laxative, and they're masking the problem. I think you agree that irritable bowel syndrome, some of them, or percentage of them, can be caused by dysbiosis, and treating dysbiosis will be the root cause, and possibly it will be a permanent fix for this problem.
Yeah.
Would you agree on that? Because that's not in the mainstream medicine. If you go to the mainstream medicine, medication for irritable bowel syndrome has nothing to do with dysbiosis at all. It's more of
Well, like I mentioned, we're talking about the root causes here. Okay, so what caused the irritable bowel syndrome in the first place?
well, the mainstream medicine management is just
Well, we're beyond the mainstream medicine now.
drugs that numb the nerves and relaxative and are therapeutic.
Yeah, so we're well beyond that now. So tomorrow morning, I'm doing a functional medicine laboratory. So we're going to go over, I think, about 10 different types of laboratory studies. And so if you will be across the hall there. Also, one last thing, and then I'll
Go.
no. One last thing. So I was at one time the executive director of the American Osteopathic Society of Rheumatic Diseases, which is no longer. We still have our group, though, and on Tuesday nights, every Tuesday night, 5 p.m. Pacific, 8 p.m. Eastern, since 2020, we hold a seminar, a webinar. Usually lasts anywhere from an hour to an hour and a half. We have different speakers every week, and you're all invited. If you get me your email address, if you're interested, I'll put you on our email list. If you want to see what we've done before, you can go to AOSRD.org. And all of the past programs have been on there. There's about 4 years worth of content Also, on YouTube, you go to Clearfield Medical Group, it'll be there also. So we'd love to have you with us. And if you have anything you want to present, it's a nice group. And if you're nervous about presenting things and getting up in front of groups, it's a good way to get started. So Monday, Dr. Halassa has his group too.
I want you to speak on Monday.
Okay.
I want this lecture.
Okay.
And when you do provide CME credit,
Oh yeah. By the way, you can get 2 AMA CME credits also for most of them. Okay, not all of them, but most of them.
and this lecture is going to be repeated on Monday.
Yeah, it's $30 for the 2 AMA. You get 2 AMA credits, and so far the DO, they don't like us. So
Okay. A big round of applause for Dr. Clearfield, both in presence and those online.